The views and opinions expressed in The Fact Is with Hollis Grant are those of Hollis Grant and do not necessarily reflect the official policy or position of Droids Canada Network. Droids Canada Network does not take responsibility for any content or position produced by Hollis Grant and his show. Listener discretion is advised.
Good morning, good afternoon, and good evening. Thank you for tuning in to another edition of The Fact Is. I'm your host, Hollis Grant, and today we are talking about the variant. It has been 83 weeks since March 13th, the date that the U.S. government, President Donald Trump, declared the coronavirus a pandemic, unlocking billions of dollars to help combat the disease. But if we're using America as the example, it's 83 weeks of 2 weeks to slow the spread. And today, we have another deadly variant. We've talked about on this show on past episodes. Please take a look at droidscanada.com for all past episodes. And you can find out when we have discussed these potential variants, all starting with the Delta variant. Now today, we are bringing news from the New York Post. Again, 83 weeks later after COVID hits, we have the Delta variant gripping the nation. And now, prepare yourselves, ladies and gentlemen, for we now have a Delta variant, a COVID variant. New York Post, dated October 20th, 2021. New infectious strain of Delta variant detected in the U.S. A new sublineage of the highly contagious Delta variant that is spreading throughout the UK has been detected in the United States, health officials said Wednesday. AY.4.2 is being closely monitored in England after British health officials revealed that the new variant, reported to be 10 to 15% more transmissible than Delta, had been linked to a growing number of COVID-19 infections there. Dr. Rochelle Walensky, director of the Centers for Disease Control and Prevention, confirmed during a COVID-19 briefing Wednesday that AY.4.2 has been found in the United States. Walensky said the new variant, which she acknowledged has drawn some attention in recent days, has not been linked to any clusters within the country. We have on occasion identified this sublineage here in the United States, but not with recent increased frequency or clustering to date, Walensky said. At this time, there is no evidence that sublineage AY.4.2 impacts the effectiveness of our current vaccines or therapeutics, and we will continue to follow. She added, in the United States, Delta remains the dominant variant, with more than 99.7% of subsequent cases in the country being caused by Delta. A CDC spokesperson told the Post that AY.4.2 is, quote, very rare in the United States, with less than 10% cases found so far, which accounts for less than 0.005% of subsequent cases. The CDC has not confirmed in what United States AY.4.2 has been detected. Former Food and Drug Administration Commissioner Scott Gottlieb tweeted about the variant over the weekend, calling for urgent research to figure out if this Delta Plus is more transmissible or has partial immune evasion. Expert told the UK's Financial Times that AY.4.2 appeared to be 10 to 15% more transmissible than the original Delta variant. British officials said last week they were closely monitoring AY.4.2 after the latest data showed 6% of COVID cases in the country were linked to the new variant. AY.4.2 has not been labeled as under investigation or a variant of concern in the United Kingdom. Experts said there was no early indication that AY.4.2 would become the dominant variant, and that it was unlikely to change the current COVID picture. Discovery of new variants is, of course, important to monitor, but it doesn't indicate that the new variant is going to be the next one to replace Delta. Oxford Vaccine Group Chief Andrew Pollard, told BBC Radio on Wednesday. Indeed, even if it does, Delta is incredibly good at transmitting in a vaccinated population, and a new one may be a bit better, but it's unlikely to change the picture dramatically from where we are today. Of course, the Oxford Vaccine Group chief said, it's incredibly good at transmitting in a vaccinated population, and a new one may be a bit better, but it's unlikely to change the picture. So you have someone that's in charge of a pharmaceutical company telling people we need to get a new vaccine into people's arms. And who pays for said vaccine? The state. Only have to look at who is speaking to these politicians, who is lobbying for these politicians. We've covered on past episodes that Pfizer has lobbied the government. We have covered that Moderna, AstraZeneca have all lobbied governments, and yet this is their highest earning to date. So when a new variant comes out, of course it will be, we need new vaccines. We need new vaccines. We have to protect people. We have to stop the spread. We have to get injections into people's arms to save people because we need to protect people. In governments, we'll keep dishing out taxpayer money saying, yes, let's save the people. We have to protect the people. And the message back to the population will be, we are saving you. We are saving lives. We are making a difference. But meanwhile, the taxpayer is being robbed blind by pharmaceutical companies. When you're looking at a disease that is so deadly that we know that the Delta variant was 100 times more infectious than COVID-19. Now we have another 10% on top of that. Go back to our past episodes where we talked about the Delta variants when it was coming out of India. 83 weeks. 83 weeks since 2 weeks to slow the spread or stop the curve. And here we are yet again with another variant. We're going into a flu season. Flu season starts. We've taken a look at the data. We know that this is the peak time. Within the next few weeks, the flu historically makes a comeback. But we can go back and take a look at the flu data and say, in the year of 2020, there was no flu. There wasn't a single person that was sick with the flu because every single flu stat was counted for under coronavirus, which was covered in 2014 in flu statistics. Yes, coronavirus is a flu. Yes, it's deadly if you're over a certain age. And we're getting back into another flu season, and we're going to go and take a look at Australia, and we know the heavy police presence to stop people and to spray 70-year-old women at a protest with pepper spray. Now let's go back to Dr. Rochelle Walensky. On Tuesday, August 3rd, 2021, CDC Director Dr. Rochelle Walensky signed an order determining the eviction of tenants for failure to make rent payment or housing payments could be detrimental to public health control measures to slow the spread of SARS-CoV-2, the virus that causes COVID-19. This order will expire on October 3rd, 2021, and applies in the United States. Counties experience substantial and high levels of community transmission levels of SARS-CoV-2. The eviction moratorium allows additional time for rent relief to reach renters and to further increase vaccination rates in the context of a pandemic. Eviction moratoria, like quarantine, isolation, and social distancing, can be an effective public health measure utilized to prevent the spread of communicable diseases. Eviction moratoria facilitate self-isolation and self-quarantine by people who become ill or who are at risk of transmitting COVID-19 by keeping people out of congregate settings and in their own homes. CDC remains committed and will continue to explore and use all the tools at our disposal to protect the health and well-being of Americans affected by the COVID-19 pandemic. The order can be found at cdc.gov/coronavirus/2019, and you can take a look on Google. Below can be attributed to CDC Director Dr. Rochelle Walensky. The emergence of the Delta variant has led to a rapid acceleration of community transmission in the United States, putting more Americans at increased risk, especially if they are unvaccinated. The moratorium is the right thing to do to keep people in their homes and out of the congregate settings where COVID-19 spreads. It is imperative that public health authorities act quickly to mitigate such an increase of evictions, which could increase the likelihood of new spikes in SARS-CoV-2 transmission. Such mass evictions and the attendant public health consequences would be very difficult to reverse. That order was signed. What it's saying is you can't pay your rent, you can live in your home, and you can't get evicted. As a renter who hasn't paid the rent, why bother paying any rent and just wait and ride it out? Live rent-free for a while, save some money to the next place that you need to go. But the owners or the landlords have no recourse and still need to pay their mortgage payments. Why is the CDC director taking money out of landowners or landlords or people that might have saved a little bit of extra money through hard work, buy a second home and decide to rent it out for a little extra income? Why should they be on the hook? And why is the healthcare system making these laws? I'd like to thank you for tuning in to this edition of The Fact Is. I'm your host, Hollis Grant, and please take a look on our Facebook page and on droidscanada.com, and you have yourself a great week.
Dan, what happens every Thursday?
That would be DCR Droids Canada Radio.
And what time is it at on Thursday?
That's from 9 till 11 p.m.
Dumb question, where do you find it?
You find that at accessradio.ca.
And what's the best part?
It's free.